Hello and welcome to our special program today as we're doing a special program on understanding healthcare reform. Let me start this program out today by simply saying this. This program is not to defend, it's not for or to oppose healthcare reform or Obamacare. We're simply here to provide information to help you and your family navigate through the system. I've said this for years as an insurance professional. My job is to help you navigate through the minefield, if you will, to find the best possible case scenario for your family. Let me just start by saying my credentials and why I'm doing this program today. I have been in the insurance business for over 8 years now. I spent 20 years in full-time ministry as a pastor. I enjoyed serving and helping families. And my wife and I moved back to Danville about 7-8 years ago now. I felt this business would help me serve people. I have served and studied healthcare reform for the last 7 years, trying to figure out, or actually since 2008, trying to figure out what's best, if it passed, what would be the best for your family. So I hope this program is a blessing to you today and provides you information. If you'll notice at the bottom of the screen, all through the program, there will be a phone number, and there will also be, in addition to a phone number, there will be an email address. If you'd like to email me a question during this program, we'll try to answer as many as possible during the program. I'm even going to figure some premiums if time permits. If you will simply just email me your age, if you're a smoker or not, and your yearly income. We will not call your name out on the air. Let me just take a moment and talk about a little bit who we are. We're Wayne Aaron. I'm going to ask you to put that on the screen one more time with Aaron and Associates. And we represent over 200 insurance companies. So we're able to shop and find you and your family the best possible deal with healthcare reform. Now, let's go ahead and get started, and let's begin to talk about health insurance and healthcare reform. And what we're going to spend some time today talking about is we're going to talk about the government's involvement with healthcare now, with health insurance. What is the government's involvement? There are many who think and feel that because you have Obamacare, that it's just all strictly government, but that's not true. The government has its hand in the health insurance market, and we're going to talk about that in a few moments and how and why. But yet when you purchase health insurance, you still are purchasing insurance from a private insurance company. So the private sector has not been ruled out all the way in its entirety. So today, I want to talk to you about how the government is involved in healthcare reform. And the first thing that I want to talk to you about how that they are involved in health insurance is, first of all, they have a mandate of what they call essential health benefits. It's 10 benefits that all insurance companies must provide to their customers. We won't have time to talk about all 10 today, but we will just cover a few of them. And by the way, as we're going through the program today, I will be sharing both positive and negative impacts of Obamacare or healthcare reform in how it affects your family. So let's talk about some of these essential health benefits that the government now mandates that all insurance companies must carry. First of all, preventative. Preventative is now a mandatory thing where the insurance companies pay 100% of all preventative services. Things like colonoscopies, mammograms, prostate exams, counseling services. So the government mandates a certain amount of child dental as well. Counseling services, and also maternity. Now, let me just share a positive point. A positive point is now you get all of your preventative stuff for free. The colonoscopies, the mammograms, all of that doesn't cost you anything. A negative point, everybody pays for maternity. It doesn't matter. For myself, I'm 48, and my wife is 40. None of your business, just kidding with you. But we're not planning on having more children, but yet we have to pay for maternity anyway. So if you're a single male and you purchase insurance, then as a single male and purchasing insurance, you're still paying for maternity. So that's one negative point. Positive point, mammograms and stuff like that is free. Let me share with you real quickly another mandate of the government that the insurance companies that they are providing, and that is that the insurance companies can no longer hold pre-existing conditions against you. Back in the day, it used to be like this. If you had a pre-existing condition like cancer or diabetes, the insurance company could either turn you down or raise your premiums through the roof. So this is a positive point. Now, insurance companies cannot hold pre-existing conditions against you. Now, this is a really good thing for some people because, and this is a positive point. We're going to be sharing both positive and negative. But it's a positive point because I've seen so many people trapped in jobs and being so trapped in their job that they couldn't go out and start that business that they had an idea for because they could not get insurance on the private marketplace. Well, now you can. You can actually do that. The third way, and we're going to spend a considerable amount of time, and remember, don't forget to email me any questions. Our email's on the bottom of the screen now. I'm going to go to it during our live program. When this program's not live and you're seeing a taping, we will respond to your questions concerning healthcare reform. But the next way the government is involved in the insurance industry now is through what's called premium subsidies or premium tax credits, dollars that the government is providing to private insurance companies in your behalf. They're also called subsidies. These subsidies come in two ways. Number one, it helps you pay your insurance premium. It actually takes money from your taxes, premium tax credit, and gives you that money if your income is in a certain bracket. And we'll talk about that in just a few moments. And when it does that, it actually gives you that money so that you can purchase insurance. You can use that premium. I've actually seen some people come into my office and get an insurance policy for zero because that's what their income, because of the premium tax credit, they can actually walk out of our office not paying one dime for the coverage. Others, I've seen $30, $40 a month. And again, if their income is too high, then they pay the full price. So it could be $600, $500, or $700 a month, depending upon your income. Now, it's very important for you, and we actually help you when you come to our office or call us. We actually, as insurance professionals, we actually help you make sure that you get this right. It's very important that you get your income right because there may be some people who will say, well, I can list my income as $20,000 instead of $40,000 and I can get my insurance paid for. Well, guess what's going to happen? At the end of next year, when you file your taxes, then if you lied or underestimated, then what's going to happen is, if you've underestimated it, then guess what? You're going to owe the government money back. Now, also, on the flip side, if you underestimated your income, then the government could, or overestimated your income, I'm sorry, then the government could actually owe you money back. Now listen, my email's right there on the bottom of the screen. If you'd like for me to figure your premium, we're going to try to do that for somebody during the program today in just a few moments. So, and then there's another subsidy that the government is given based on income, and that's a cost-sharing subsidy. And what that means is, that means that you could get a premium tax credit, helps you pay your premium, or you could get a cost-sharing subsidy, which basically lowers your deductibles and lowers your copays. So that is a big help. I've actually seen a lot of people come in our office and their maximum out-of-pocket expense was $1,000, which is a really great thing, and a deductible of $0 and a copay of $0 by going to their regular doctor. Now, we had some slides to show you today, but to be really honest with you, we're having some technical difficulties, and as of yet, we don't have them. So, unfortunately, I'm just going to sit here and talk to you, but please feel free to email us and call us, and we will be able to try to help you more. Now, if you're here today, or if you're watching us today live, go ahead and send me an email now if you have any questions, and I'll do my best to answer them while on air. Or if you're watching the taping, we will actually try to answer your questions by returning your email and trying to help you more there. I'm going to take a moment right now and go to my email and see if we have any possible quotes or anything coming in, any questions coming in that we could answer on live on the air today. I'm going to go ahead very quickly and try to go ahead and quote one premium for you, just to give you an idea of how the situation works. And Doug, if we could, let's go to that Aaron and Associates slide one more time. And again, I am Wayne Aaron with Aaron and Associates. We've been in the insurance business for a number of years. We also have over 7 different agents, have one right here in Martinsville, Virginia. For those of you that are watching the program live in Martinsville, we actually have an agent here by the name of Johnny Brown. He's a great guy, and he can actually come to your house and actually help you. Okay, let's go back here. Let's just see if we've got a good internet connection here. And I'm going to try to actually figure a premium out. Again, if you're watching the program live, go ahead and send me an email with any questions that you have. And let's just take a moment here and see if we can get a premium quote if we have a good internet connection here. And it looks like that we do. Okay, remember, we're talking about subsidies and tax credits. Again, if your income falls in a certain level, if it's too low, you don't get a tax credit because the government, or Virginia, I'm sorry, did not increase Medicaid. But if your income falls on the right level, then you can get a tax credit. In fact, a family of 4 with an income of under $94,000, so it's pretty generous, can actually get a tax credit. But let me run a number here really quick. I'm going to take let's do a single male. Give me 1 second. Let's take a single male here. And again, my email's at the bottom of the screen. If you have any questions, please feel free to email us right now. We'll use a Martinsville zip code. Okay, and we're going to use the county as, let's do Martinsville City. All right, and we're going to do a single male with an income of $16,600 a year. Okay, and we're going to do that for a single male, 1 person, and we're going to say this male is, let's say 35 years old. Okay, 35 years old. Let's take a look at what the premium will be. This is a calculation system that we use, and with my experience being on the exchange, it does very well. For a 35-year-old, he would get a full-fledged major medical plan, prescription drug coverage, doctor's office visits, all of the above for $49 a month. Now let me show you something else. Let's take a 35-year-old male and let's lower that income to about $12,000. I want you to see that and what that would be. And again, if you have any questions, please feel free to begin to email us now. I'm actually checking our email during the program as we go along today. All right, we got a 35-year-old male, $12,000 income. His cost for an insurance policy, full-fledged major medical, would be about $20 a month. But let's say we have a high-income earner, and that is with low deductibles and copays too. But let's just take a high-income earner, and let's just say we have somebody with a $40,000 income, and let's take a look at that and kind of show you the difference. And these are the kind of folks that are mad. Well, his insurance has now went from $20 a month to $272 a month. Of course, there's ways that we can try to figure and help you lower that premium as well. Now, I know this is one that's on everybody's mind, so let's take a family of 4, and I'm sure there's a lot of you out there with a family of 4. Let's do 2 adults. Let's do 2 children, okay? And let's figure that income, at $60,000, okay, for a family of 4. So at that rate, at family of 4, the person would be paying about $407 a month for a family of 4, and they probably would qualify for cost subsidy too, which would actually lower their deductibles and lower their copays. Let's take a family of 4, okay, and let's figure that income at $80,000. Okay, I'm sure that it applies to many out there that are watching. At that rate, they would be paying for a family of 4, $80,000, about $637 a month. Now, let's go back down and figure it at about $35,000 just to show you the difference here. At $35,000, okay, a family of 4, they would be looking at about, let's see what we've got here, they'd be looking at about $112 a month. So as you can see, that's why it's called, the Affordable Care Act. Look, again, I'm not speaking for or against this. My job as a professional is just to simply help you navigate the system to find the best possible case scenario for you and for your family. Now, it's very important to understand this too, and just keep it on the screen for a moment. I would really recommend that that you call us or let an insurance professional help you. There are a lot of people who will call in directly to say healthcare.gov or to other entities, and those folks don't know anything about networks that are on the ground right here in your local area. Myself and my 7 agents, we spend hours and hours studying programs and meetings with insurance companies, looking at networks and looking at doctors' choices so that we can get you the best possible case scenario. I've had people come into my office that called some 800 number from somebody in Oregon who tried to help them, and they ended up with not even having a medical plan. I've had others that would call in directly to the 800 healthcare.gov, and they wouldn't realize it, but they'd be $300 or $400 away from a subsidy to help them cover their insurance. And we figured that out for you. And if you're $300 or $400 short, where if you call the 800 number, they're going to say you don't qualify for a subsidy. If you're sitting in my office, I'm going to say you're $300 short. You're about, I don't know, $5 or $6 a week short is all you need to be able to get a subsidy. Can you work some overtime? A lot of times people will say yes, or can you cut grass? Can you cut your neighbor's grass? Can you find $300 worth of income in a year? And many times they'll say yes, and then we'll help them get that subsidy to get their insurance cheaper. We've also heard reports of a lot of people that will be calling in, and they would choose a health care plan, and if they wanted to go to Duke University, they couldn't go. If they wanted to go to Winston-Salem Baptist, they couldn't go because it was out of network. We will study hard, we will work hard for you, and we'll try our best to get you the best possible case scenario for you and your family. I want to just say this, we're in the insurance business because we care about you, and I mean that. We don't think of ourselves when people walk in our office. Myself and my 7 agents, including Johnny Brown here in Martinsville, we think about you. We don't look after ourselves. So if you call us, I will assure you that we'll do our very, very, very best to help you. And there's a picture of Johnny on the screen right now, and some of you probably know him. He's right here local in Martinsville, Virginia. And he'll actually come to your house and serve you. We have 7 agents. We're actually licensed in Virginia, North Carolina, and West Virginia, and we'll do our very best to serve you. So please call in. Let us help you. Let us serve you. We've actually got systems that when healthcare.gov's backed up, we can actually go around that, and we average 25 minutes of what it would take someone an hour and a half to do online or on the phone themselves. Listen, I know that this is a tricky time, a tricky season. I didn't get a chance to share this because of time, but there are a lot of Virginians who their health insurance is going to expire on December the 31st. And I know that you need help, and we're offering ourselves to you. Please give me a call and let us help you. Special shout out and thanks to the folks at BTW 21, and hopefully we'll maybe air some more stuff on into the open enrollment season, which starts tomorrow, Saturday. And we wish everyone well. If we don't see you before, have a happy Thanksgiving, and we'll talk to you next time. God bless.